Providing a historical perspective on immunotherapy. I think the development of immunotherapy may be the most exciting development in oncology, if not in all of medicine, in the last decade. We've known for probably about 100 years that the immune system can recognize and eradicate cancer cells, but really being able to use it and show an effect in patients is a relatively recent phenomenon. Much of the advance that's occurred has really happened by a better understanding of the basic biology of T cells. We believe that T cells have various regulatory pathways that turn them on and that also turn them off. And importantly, cancers have really learned how to turn these T cells off. And so by really blocking those brakes on the T cells to keep them on, either alone with, for example, the T cell checkpoint inhibitors, or in combination with other agents that can really activate the T cells, we're beginning to see really dramatic responses in patients with cancer. We also recognize that there are other elements of the immune system. There's innate immunity, there are B cells, there are dendritic cells, there are cytokines, probably other soluble factors, and all of these come into play. But the improved understanding that we have is really translating into tangible benefit right now. And so it's led to real excitement in the field and a real paradigm shift, I think, in how we're approaching dealing with cancer treatment in general. And I think that the old thinking that cancer was a single target that we would go after is being really replaced by the thinking that a cancer is arising in a complicated environment, what we sometimes call the tumor microenvironment, and that one has to think about not just the cancer cell, but also the stromal cells, the vasculature that's present, as well as the immune system. And by really targeting all elements of this complicated environment, I think we're really going to continue to see ongoing progress. In thinking about the most exciting studies that are being presented this year at ASCO, there's, in general, I would say the interesting thing is that immunotherapy is really being extended to other types of cancer. So while historically we've often thought of melanoma and renal cell carcinoma as being responsive to immunotherapy, I think last year and the year before we really learned that lung cancer and other solid tumors might be amenable to this approach. A very important paper being presented this year is studies with PD-L1 antibody in patients with bladder cancer. And we now understand that the PD-1, PD-L1 pathway is a particularly important target for immunotherapy because it seems to affect a very wide range of cancers. And the work in bladder cancer is especially important because there have been very few advances in the field of bladder cancer really until this report. And I think this will also open the door for combination therapies in this disease. And there are several reports of earlier phase studies combining the T cell checkpoints with BCG, for example, or with other types of vaccines. The other, I think, big news is that the different PD-L1, in this case the avelumab, has also shown promise in the treatment of patients with advanced Merkel cell carcinoma. So Merkel cell is a particularly aggressive form of skin cancer. Although it's quite rare in the general population, it is increasing in incidence. And this is a disease for which we've had very little therapy. The traditional approaches have been with chemotherapy, which usually has not translated into significant survival benefit for patients. And in a fairly large study of 88 patients who were treated in second line after already failing chemotherapy, the avelumab treatment was associated with a 32% objective response rate, and an additional 10% of patients had stable disease. So this is really quite remarkable for such an aggressive disease. And in this particular study, responses were seen in a median time of 7 weeks, suggesting that not only were responses quite good, but they happened very rapidly. So this, I think, is really going to change the treatment paradigm for patients with this disease.